Hello, everybody. I'm Dr. Janine. I am back with Thursday Tips with Dr. Janine. It's been a few weeks. I've been away from Facebook Live due to traveling and then getting back home and being jet lagged. So I am back for our weekly Thursday Tips. And just waiting here for a few people to join today. Please let me know that you're here by just give me a wave or a like or something so I know that you're joining. All right, so we have Shad here. Thank you so much for joining in today to discuss an important topic. So we're just gonna wait for a few more people to join and I'll get started. All right. Okay. So it's fall. It is finally fall. Not looking forward to it. It's cold, and guess what? I put the heat on. So yeah, it's very cold, and I can tell in the house that it's cold. So the heat is on in my house. All right, just waiting for a few more, and then we'll get started on the important topic of the day. All right. And another funny thing is that I realized that pink is not my favorite color. So I know, this month is Breast Cancer Awareness Month, and I'll be talking a little bit about that in a few. And I was just looking for something to wear so I can be pink for today's topic. And realized that I don't have much pink in my closet. So, but I found something. Alrighty, so I'm just gonna get started. If anyone else joins, just please let me know so I can acknowledge that you are here. All right. So for those that don't know me, I am Dr. Janine. I'm a board certified family medicine doctor and weight loss specialist. I help women get their sexy back by offering a comprehensive weight loss program virtually. So I'm an owner as well for Lifestyle Changes, which is a virtual medical practice that specializes in weight loss here in Pennsylvania. So today, coming to you live to talk about breastfeeding and breast cancer. So let's discuss the connection here. All right. So as you know, breastfeeding has many health benefits, not just for the baby, but also for women. So it's health benefits, it decreases your risk of diabetes, also ovarian cancer. And then the big topic that I'm going to discuss today is breast cancer. It decreases your risk of breast cancer. So for those women that are unable to breastfeed, it's okay. It's all right. But I just, came across this topic and just wanted to share with you some of the findings about breast cancer and breastfeeding, the benefits of breastfeeding, decreasing the risk of breast cancer. All right, so I'm just going to go over a few facts about this. So the first fact is it lowers your risk of breast cancer, especially in premenopausal women. So you can also it decreases risk in postmenopausal women, but you see the significance more in premenopausal women. So these are women that are still having their period, menstruating regularly, that you can see benefit from breastfeeding. Another fact of breastfeeding is if you breastfeed for a longer period, it protects you more against breast cancer. So one study showed that women who breastfed for a longer duration had greater protection against developing breast cancer. So if you were breastfeeding for, let's say, 12 months, cumulative, so not in a single period of time. So you can split this up amongst your children. So if you have two children, you can breastfeed one for 6 months and the other one for 6 months, and that gives you the same risk reduction of breast cancer. All right. And then another thing with breastfeeding, how it lowers the risk. It also lowers the risk of breast cancer in those that have a family history. So folks that have a family history in their immediate family member, like their mom, sister, even if you have a male relative, because you can see breast cancer in males as well. It's rare, but it happens. So if you have a father or a brother or something like that, that increases your risk of breast cancer or developing breast cancer. So with breastfeeding, it decreases your incidence of cancer with those women. Hi, Miss Carolyn. Thank you for joining. We're discussing breastfeeding and breast cancer. What's the connection? So those that have an increased risk of breast cancer due to family history, if you breastfeed, that reduces the incidence of getting breast cancer. Okay, so a study has shown that it decreases the incidence of getting cancer than those women that did not breastfeed. Okay. The other thing with breastfeeding, it does lower the incidence of a recurring cancer by 30%. So like I said in the beginning, breastfeeding decreases your risk, but it does not cure you from not having breast cancer. So you can still have, breast cancer even if you have breastfed. Okay. So, but anyways, if you have been diagnosed with breast cancer in the past, it does decrease the incidence of recurring cancer. So that's 30%, okay, by 30%. So this is if you breastfed for about 6 months or longer, all right? Hi, Dr. Mashika. Thank you for joining. We're talking about connection between breastfeeding and breast cancer today. All right. So the other thing that happens is while breastfeeding, you alter the hormonal levels. So, some women don't see their menstrual cycle while breastfeeding, and that's due to the alteration in the hormones. So you also decrease your estrogen exposure, so that also shows that you may decrease your risk of getting breast cancer as well. Also, there's different types of breast cancer. So with breastfeeding, you can reduce your risk of those cancers that have estrogen receptors negative or a triple negative receptor, which includes estrogen as well. So those are a few breast cancer types that with breastfeeding, you can reduce your risk of getting those. All right. So let me just go over, the facts of breastfeeding and how it decreases your risk of breast cancer. So the first one was it lowers your risk of breast cancer, especially in those that are premenopausal. All right. So in premenopausal women, breastfeeding can reduce your risk of breast cancer. All right. Number two, breastfeeding for a longer period protects you more against breast cancer. All right. And number 3, it lowers your risk of breast cancer if you have a family history, a strong family history. And number 4, it lowers the incidence of recurring cancer by 30%. And then number 5, it alters your hormonal levels, so it decreases certain types of breast cancer as well. All right. Any questions so far? Okay. All right. So October is Breast Cancer Awareness Month. And I'm sure you've seen a lot of women around with the pink ribbon. I don't have one, and like I was sharing earlier, that I don't have a lot of pink, but I try to do my best today with the pink lipstick and the shirt here to represent Breast Cancer Awareness Month. So what can we do during this month? I have a few tips I'd like to share with you. So the first thing is definitely know your family history. Know your risk, all right? So any immediate family members like your mother, father, sister, brother, and such, you are, that has had breast cancer, you are at an increased risk. All right. So make sure you know your family history. Make sure you know your risk. Talk to your doctor about this. And so you can come up with a plan of, screening. So the next tip is get screened. All right. So screen annually with the mammogram, which is the diagnostic test, starting at 40 years of age for most women, especially those with the increased risk due to like family history. All right, so get screened, schedule your mammogram. I scheduled mine the other day for my annual. So I'll have it in a few weeks, and I'll be sharing with y'all, that when the time comes. So get screened. Oh, awesome. Good job, Dr. Mashika. Wonderful. She got her mammogram today. Wonderful. Kudos. All right. So number 2 was get screened. It's very important. There is a test to help diagnose if if there was anything. All right. Number 3, know your breasts. All right. So what that means is, it doesn't have to be every day, but make sure you feel for, you do self breast exams, know what your breast feels like, regularly. Definitely do not check your breasts prior to your menstrual cycle. It will feel lumpy and bumpy, and no, you'll be scared. So don't do any self exams before your menstrual cycle. All right. Learn what your breasts feel like. All right. So some women have lumpy breasts. Some women have more breast tissues than others, but just realize that. And, from month to month, day to day, you'll know if there's any changes. All right. So number 3, know your breasts. All right. Number 4, make healthy lifestyle choices. What does that mean? I know I've spoken about this. I am the weight loss specialist. I talk about a healthy lifestyle. I live a healthy lifestyle. So let me just share again what those healthy lifestyle choices are. So number 1, healthy weight. Maintain a healthy weight. This is important in decreasing your risk of breast cancer. Maintain a healthy weight. Another one is exercise. Make sure you exercise regularly and frequently. That helps, and it also helps you maintain a healthy weight as well. And limit alcohol. Drink alcohol in moderation. So I'm not saying get rid of it altogether. I know, some of us need a glass of wine, daily, but drink in moderation. And then the last thing is what we've been discussing today is breastfeed if you can. So that shows, a lot of studies have shown that breastfeeding helps in lowering your risk of getting breast cancer. All right. So These are a few tips. So number 1, know your family history. Number 2, get screened, get your mammogram, schedule your mammogram. 3, know what your breasts feel like. Do self-breast exams regularly. And number 4, make healthy lifestyle choices. All right. So that's it for today. Happy Breast Cancer Awareness Month. Schedule your mammogram. All right. And have an awesome day. Thank you all for joining me today. I'll be back next week. Next week I'll be somewhere different. Not telling you, but and I'll probably have a special guest as well. So join me next week, Thursday, hopefully at 1, because I'll be in a different time zone. So, but I'll let you know when I'll be back. And I'm signing out for today. So Dr. Janine, board certified family medicine doctor and weight loss specialist. I help women get their sexy back by providing a comprehensive medical weight loss program. So thank you again for joining, and I will see you next week. Have a great day, everybody. Bye-bye.